Welcome to Prepare Tennessee LTC, a podcast created to provide resources and information on the current topics experienced within Tennessee long-term care and skilled nursing communities. I'm your host, Rachel Turner, an Associate Program Manager here at Vanderbilt University Medical Center's Program in Disaster Research and Training. In this episode, Dr. John Walsh, a co-director at Vanderbilt University Medical Center's Program in Disaster Research and Training, will be speaking with Dr. Russell Peterson, a retired division chief and emergency management and continuity program manager. In this podcast series, facilities will learn what to do in the event of a tornado or severe weather.
Well, thank you, Russell, for meeting with us today. And one of the things, since we're getting into the spring season here in Tennessee, obviously, that's tornado season for us, even though we have them almost every month of the year, at least some point in time. But one of the things that long-term care and skilled nursing facilities have to deal with is all kinds of issues with weather-related types of threats, and tornadoes are the ones we're going to focus on today. So what can long-term care and skilled nursing facilities do to prepare both their staff and residents in preparing for these types of weather events?
Well, thanks for having me. And that's a great question. I always kind of revert back to when I was a kid and I was playing in sports, and our coaches would always tell us that you can only play as well as you practice. And so my recommendations as to how you can prepare yourself really kind of revolves around an acronym that we've learned that we use within the emergency management field. And the acronym is POET-E. So it's POETE. Within emergency management, we use that as a way to build capacity, to build capability, and to improve our readiness. And so the POET-E stands for planning, organizing, equipping, training, and exercising. And so it really starts out with a good plan. And General Eisenhower has been quoted as saying that it's not the plan that counts, but the planning that counts. And so just the process of going through the planning process is super important.
One of the things, Russell, is that all of the long-term care facilities and skilled nursing facilities are required to have an emergency preparedness plan, and all of the centers for Medicare and Medicaid services are required to have and comply with the final rule regulations. So plans, hopefully, their facility administrators have instilled these plans in their response mechanisms. What do they need to do as far as with organizing and things? They have interaction with emergency managers, the law enforcement, fire services within their communities. How can they better prepare for these types of events with those agencies and response components?
Yes. And given that you have an actual plan already established and it's up to date and that it's been reviewed, it's really good to have those plans reviewed by your local emergency management and fire service. And the reason you want to do that is so that everybody's on the same, basically on an equal playing field. You really want to know from the long-term care facilities perspective, you want to know what your fire and your emergency management agencies are capable of doing. And it's equally important that your emergency management agencies and your fire service understand what your plan is. And so, plans are very important, but plans really establish responsibilities. And so it just lets people know that if an event occurs in the future, these are the things that we're going to take care of. And these are the things that you'll take care of. And so by comparing those two responsibilities, oftentimes you can find gaps. And I know of instances where people have written into a plan a particular capability that they assumed the other organization had, and the other organization did not have that capability. So that was a gap that existed that surely would have impacted the organization in the event of an emergency.
What can a facility do? Say there is a tornado warning, which really equates to either an actual observation of a tornado, either on by visual or by radar that may be coming towards their facility. So what would the facility need to do to deal with their ambulatory and non-ambulatory residents within those facilities?
Great question. I really think there's two parts to that answer. The first is it's really important to kind of play it out your plan before the emergency. And so the use of drills is really important so that the staff develops some muscle memory so that they know how to act in the event that there's a true emergency. And then the second half of the answer would be what I've heard termed as a bias for action. And so you've got to take that action. You can't wait and try to reconfirm and reconfirm. I think a lot of times with people, when they're facing an imminent danger, they stop and try to reassess to determine whether or not that danger actually exists. And particularly with tornadoes, you just don't have the time to spend a lot of time reassessing. And so you really need to have that bias for action, and you need to put people into action and moving those patients out of the areas of vulnerability into areas of safe refuge and into areas where you've identified they'll be most protected from the hazards of the storm.
So where would those locations be, some possible locations be in those facilities?
If you can get into a basement, if your facility has a basement, that's the best location. If you do not have a basement, basically enter any center corridor or inner corridor. You're looking for places that are away from windows. You're looking to get away from like wide open areas. So typically the more walls you have around you, between you and the storm, the safer you'll be. And oftentimes that's going to be a center hallway or some kind of a center corridor.
Now, for those patients that are unable to move to a center hallway or things of that nature, what would you do with them in the room? I know probably you'd want to get them away from any glass and things of that nature, but are other things that can be done with protecting those individuals in some form or fashion?
Yeah, absolutely. The first step, like you had mentioned, is to try to get them as far away from the danger as possible. And so, we learn in radiological response about time, distance, and shielding. And so the further distance you can get them away from the hazard, the better off they will be. The second part of that is shielding. And so whatever you could put between them and the hazard will improve their survivability. It may be extra blankets on top to try to protect them from flying fragmentation, and whatever you can do to try to shield the patients from the hazard.
So would a mattress, maybe cover them with a mattress, something along that line be advisable?
Absolutely. If you have that available, that would be perfect.
Russell, we've got just a few more minutes here, but you mentioned something about exercises, and I know we're going to concentrate that on the next session that we have. But what can you just tell us about some of the training and the exercise component of your response to tornadoes and severe weather?
I would definitely start off with just kind of recommend that you practice like you play and you play like you practice. And so take advantage of whenever you can to practice the plan. And that's putting people into position and having them basically go through the motions of that evacuation drill. That can include a formal drill. When you think about our local schools, you think about them having fire drills and tornado drills that are formalized. But don't miss the advantage to take some advantage of non or informal drills. For example, if you're moving people from one area of the building to another area of the building for, say, a special event, that's a perfect opportunity for you to practice your evacuation plan. So just look for opportunities, and no need to concern the residents when you're doing it. Just taking advantage of the opportunities that you see to practice your plan.
I know a lot of places use staff meetings and different shift changes and things of that nature, maybe just to talk through some of their plans and some of the things that they would do in these types of situations. Would you recommend that they take advantage of that, whether it's just 5 or 10 minutes of say 4 or 5 different staff members just talking about the plan and what they would do and who would be responsible for what during these types of situations?
Absolutely. And that's critical for newer employees, new hires, so they understand what the plan is. But, we all have short memories. And what's crucial is that you really want that plan to be memorized and remembered by the staff under times of stress. Having a repetitive process of where you're discussing that plan. And it can be as much as, something as simple as like you're mentioning, like a tabletop exercise of we're expecting bad weather today. In the event of bad weather, what are you going to do? And just go around the room and see if people understand the plan and if they understand what their role in the plan is. And I think that's a great recommendation to periodically take advantage of trainings and staff meetings and operational brief outs.
One thing as we close here, Russell, what about using or having, say, 1 or 2 weather alert radios within the facility somewhere and strategically and, within the facilities, maybe an office that's manned by a person or a nursing station or something along that line? Do those devices, are they beneficial to, facilities in general?
That's a great comment. I think as time moves on, there's an increasingly greater amount of reliance on mobile phones for emergency alerting through the iPOS system. We really like redundancy in the emergency management world. And so we like to have more than one way of getting an emergency notice. The phones are great because they're typically on you. And in the event of a tornado warning, it will sound. You'll get the alert. But nothing beats the weather radio for getting an emergency alert. I'd also recommend having the TV on during those times where you have an enhanced risk of severe weather. Leave a TV on, basically a local news station. So just so that you're weather aware, and in the event that there's a storm close to you, you'll be able to track proximity of the storm to your location. But the weather radios really are a very effective way of receiving emergency alerts from the National Weather Service, and I highly recommend it.
Thank you, Russell. We're out of time, but on the next session, we're going to go into the exercises a little bit and how to prepare staff better for these types of events. So thank you for your time. And Rachel, we'll turn it back over to you.
This concludes part 1 of our podcast. If you have questions regarding anything that was mentioned in today's podcast or would like to learn more, please visit our website at www.emergencyltc.org.